for the invitation to be here. I'm just delighted to be in this beautiful CSR space. My name is DiNitto, and I am a faculty member in the School of Social Work here at UT Austin, the Steve Hicks School of Social Work at UT Austin. And my topic today is youth and substance use policy. And I want to preface my remarks with 3 points today. First of all, we can't just look at youth and substance abuse policy, because youth started off, right, as a fetus, as a child, then we go to youth, and then after youth, people go into emerging adulthood or young adulthood and older adulthood. So being a young person is just one phase in the life cycle, and things that happen before people reach youth and policies that affect people early in life are just as important as those that affect youth. And then I think we'll also see that policies and experiences have snowballing effects that affect people throughout their life. So I'm going to use a life cycle approach here to show how policies will affect youth and affect them before and after, and we'll take a look at things that way. The second point I want to make is about the biopsychosocial approach to alcohol and drug problems. So I know that the Pop-Up Institute is embedded and founded on a biopsychosocial approach, and I'm a social worker who of course love the biopsychosocial approach because it is a big look, a big picture look at things, and policies are a big picture or macro look at things. However, I have to tell you that we still don't know the exact cause of substance abuse problems, right? Not a surprise. I mean, we think that biological, psychological, and sociological factors are involved, but we haven't pinpointed the exact cause of these problems. And that brings me to my third point about policies. Policies are not often rational. They're often not grounded in evidence or science. Policies are more about people's values and opinions oftentimes than they are about evidence. So because we don't know the exact cause of substance use problems, we develop policies that we think might help. But often they don't, because we don't necessarily know the cause, and often those policies are misguided and not based on evidence. And I think our war on drugs has been a good example of that. Policies based more on emotion than on the evidence. So let's keep those 3 points in mind, and let's take a look at things. So I first want to talk about policies that affect the fetus or the unborn child in pregnancy, because that's where things start. So hopefully every child started off as a twinkle in their parent's eye, but in many cases that may not be the facts of the matter. Fortunately, we do have some policies that have, like, say, warning labels and promote public education about the use of alcohol and drugs during pregnancy, right? So we have that package of cigarettes, we have containers of alcohol that have warning labels, and we have public education campaigns through public policy that warn women and men that consuming alcohol during pregnancy may harm the fetus, right? And lots of people get that message, and that is great. However, some people don't know that they're going to become pregnant. They have an unplanned pregnancy, and they may be using alcohol or drugs. Now, through the healthcare system, they become aware that this is not a good idea to do, and they stop. But for other people, that is not the case, and they continue to use alcohol and drugs during pregnancy, which can certainly have effects on the developing fetus and the child at birth. Right? So we think of public health policies and public health campaigns that can be helpful for most of the population, that level of prevention. Another set of policies that I think we really need to look at closely when we think about substance use is our healthcare system. Now, we could do a whole day or 2 or 3 or a week on our healthcare system in this country. But one of the things that we know is that healthcare in this country is a privilege and not a right, unless you're in the most dire circumstances. So one thing I think we need to do to develop healthier environments for our children is to have a much better healthcare system in this country. Because really, since we don't know the causes of substance abuse, through policy or through other efforts, all we can really do is try to reduce the risk factors for substance abuse problems And then, if a person develops a problem, policies that help us intervene. All right? So there are some very promising things going on in the healthcare environment, some right here at UT, through Dell Medical School and other entities like the School of Social Work and Psychology and Nursing that are contributing to improving healthcare policies that help reduce substance use and intervene in problems. So let me give you some examples of that. One has to do with a health home, right? Our healthcare system in this country is much more focused on responding to health problems than it is on prevention in a healthy environment. And we also have a much bigger focus now through the Health Resources and Services Administration in particular on what is called integrated behavioral health care. So integrated behavioral health care is the preparation of physicians, nurses, psychologists, social workers, other people working in the healthcare environment to intervene in mental behavioral health problems, substance abuse problems. I really don't like the word behavioral health, but I won't go into that now. So let's talk about substance use and mental health problems. How many people really are willing to volunteer to go to substance abuse treatment and in a treatment center or to a mental health center? Right? It's not people's favorite thing to do. However, they might be willing to volunteer to go and see their health care provider. Most people go to a primary health care provider. So in those cases, we are preparing those kinds of entities to deliver substance abuse and mental health services in those environments. So that if a woman or a couple shows up and they're pregnant and there are substance use problems, they can get the help they need to prevent, to stop using, and they get an intervention right there. So our healthcare environment would be much better off. I'm going to sound like Bernie Sanders, and I mean to sound like Bernie Sanders, because I think his message is so important. We need universal health care, a system of health care that puts people in touch with long-term health care providers and that can intervene in these problems. Because, there have been days when healthcare providers would have liked to avoid those people with substance abuse problems, right, rather than embrace them and think of mental health and substance abuse services within the context of healthcare, a much more holistic approach. The other concern comes about when women and couples don't seek a prenatal health care because they have substance use problems and they fear involvement with the healthcare system because of that. Another critical juncture comes in when the child is born, because if the child has been exposed to alcohol or drugs, child welfare authorities might become involved. Right? So this is another critical juncture, because if the home environment is deemed unsafe, then child welfare may remove a child from a home, and that child may go into foster care. And there are many wonderful foster care parents out there, but I think we know the outcomes for children in foster care in this country. And some of those are that they have higher rates of mental health and substance abuse problems, teen pregnancy, lack of finishing school, homelessness, etc. So what does this have to do with policy? Well, I want to suggest that we really need to front-load policies to prevent substance use in youth in the first place, with much healthier kinds of environments. So in this country, we lack home visiting programs when children are born into families, right? We have a very stingy public assistance system that is very difficult to access. We have Medicaid, which is a healthcare program for low-income people, but you have to be fit in a certain category to be eligible for Medicaid services. And in Texas, we did not expand Medicaid under the Affordable Care Act like they did in other places. So we have lots of policies that are working against us in terms of healthy development. And you might know the concept of ACE, adverse childhood events. Right? So the more adverse childhood events, like being born to substance abusing parents who aren't unable to provide appropriate care, or being in foster care, etc., add up, right, to create problems. So if we really want to think about important public policies, we need to think about how we can prevent those kinds of risk factors so that young people do not develop substance abuse problems in the first place. And so I think one of the most important things we can do then is front load those policies that support parents. Also, many people are growing up in disadvantaged environments where they don't have access to good services, youth centers and other kinds of services that are going to help engage them in healthy activities from the time they are young children so that they can develop a good sense of self-esteem, a healthy sense, be exposed to positive role models, engage in pro-social activities. Okay, now this child has survived and is going into school, and we talk about the school environment and school policies that affect children in substance use. So one thing I think we need is good early on education about substance use, all right? Factual education, all right? Not scare tactics or those things, and also the kinds of services that, again, help build and support a child's healthy development through the school system. Communities in schools, programs, and things like that. Those programs should be struggling for funding. We should welcome those programs and support them wholeheartedly. We have zero tolerance policies in some schools, which sometimes I think amounts to zero tolerance for children. Yeah. Children will be children, right? And we need other kinds of mechanisms, such as restorative justice programs, that can be used in the school environment to support children, and rather than, expel them or suspend them, to incorporate them in the school environment, right? We have had to resort to alternative schools that understand these problems better, when I think that the school environment should help children regardless of their situations. And I understand that schools are overburdened with lots of problems. That's why we as a community have to support schools and add these services, including more social workers in the schools. Okay. We've also resorted to other unfounded policies like drug testing. Oh, we should drug test all the children in a school. Well, we know that those resources are not well spent, just like they're not well spent in drug testing everybody who wants to get public assistance programs. The other thing that I think we really need to talk about is our criminal justice system, juvenile justice and criminal justice systems. Because once people get involved in those systems, you can see the snowball moving here when we don't have good policies. It's growing and growing, and not in a good way. Then we have the criminal justice system. When people get caught up in that system, we know what happens. And I'm talking probably to the choir here, but we treat substance use in such a different way than we do many other problems. So we know if you get involved in the criminal justice system and you have a felony in particular, it's harder to get a job. Federal financial aid to go to a fine institution like this might be denied to you, right? Housing, all right, public or private housing, more difficult to get if you have that kind of conviction on your record, and we see that snowballing as well. So these are all issues that we have to take into consideration. And there are other things going on in the environment out there as well that affect young people as well as adults. One of them is marijuana legalization. And as I've gone to conferences and talked to people involved in this field, they say there's no longer a question of whether we will legalize marijuana, but when will it be legalized throughout the country. All right, more states have legalized for recreational purposes. Fortunately, the data so far looks good with regard to youth. Youth substance use does not seem to be increasing, but it is among all groups of adults, i.e. 18 and older, and 18 is still pretty young, right? So we'll have to monitor that situation very closely. But, in the sort of alcohol model again, where you have to be 21 to purchase and things like that. But that environment is changing drastically. We also see some other important things going on, such as the availability of naloxone to prevent opioid overdose, which people in this room are very much involved in, and that's certainly very important. So the war on drugs is, I think, slowly being reversed in many ways. But we have had other kinds of things, again, related to the healthcare system, that are also kind of tragic. We used to provide supplemental security income, which is a public assistance program for low-income people that had substance use disorders. And we used to provide Social Security disability insurance for substance use disorders. Now, if you have a substance use disorder, unless you have another disability, you don't have access to those things based on a substance use disability. So we call substance use a health problem, and then we treat it like a crime. And our policies and our thinking don't necessarily match here. The people that lost their SSI and SSDI as a result of those policies then lost their health care access. And oftentimes, their ability to participate in treatment went down. We do have better parity laws for substance abuse treatment that affect youth and adults that are good. But why do I hear that the main reason that people don't get substance use treatment is because they can't afford it, they can't get access to it? There's something missing in this picture that we have to address. Parents spend lots of money trying to get their children help, but good help sometimes is hard to find because of the lack of evidence-based programs as well. So we've got lots of things going on in this environment. I'm going to just close my remarks now so we can have some discussion, but let me just say two things. For a long time I had two, I'm sorry to say, obituaries on my desk. One was a young woman, one was a young man. A young man of color, or a young white woman, I think it was. And in those obituaries, their families had clearly stated that they died of drug overdoses. And I have to give those parents a lot of credit for being willing to say that in their child's obituary, right? But obviously, they had done everything they could, I feel certain, to help their child. And this, to me, was a call or begging for a system that is more helpful to people that have alcohol and drug problems. And I wondered, what would it have taken to save the lives of those children? Could we have had policies that had done a better job? Naloxone might have been one of them. But naloxone, widespread availability came way too late for those young people. What about needle exchange? Right? As far as I know, it's still illegal in Texas. And to me, this is a blatant disregard for human life. Other kinds of policies, I know this is, maybe too far thinking for people in this country in many ways, but safe injection sites, all right? Things that go on in other places, but we still have those very puritanical views of substance use and substance use problems. So public policy is not a perfect tool. When we develop policies, oftentimes we create some other problems that we hadn't intended, spillover effects, but I really do believe we can do a lot better by our young people and people in general with a system of public policies that is more welcoming, that actually treats substance use disorders as health and public health problems. So I will stop there.